So when we went to go look at, okay, we see that the women are much healthier, this looks like it's probably due to the change in diagnostic criteria, and that it's consistent with what we see in the placebo arms of clinical trials today. So having an average relapse rate of about 0.4, so that's one relapse every 2.5 years in the years prior to pregnancy, that's spot on with the placebo arms of the dimethyl fumarate trials. So we're pretty certain that this has to do with how we diagnose MS today, that we're diagnosing people earlier with this disease that would have never made it into previous studies, and also diagnosing much milder cases. But when it comes to that, why aren't they getting a rebound risk of relapse in the postpartum period? Again, we were interested in this trade-off between breastfeeding, particularly breastfeeding exclusively, not breastfeeding at all, and resuming treatment. And there was a very pleasant surprise. Over 80% of the women in our study breastfed at least somewhat, and about 36% breastfed exclusively. And we think this is actually mostly due to our baby-friendly hospital staff. There's been a large push in our hospitals to help support all mothers, including those with chronic diseases, to increase their breastfeeding rates because of the known health benefits for the baby and also for the mother's long-term risks, long-term health. When we looked at these in multivariate models, we were able to actually look at the treatment choices and the breastfeeding choices simultaneously, because we did have about 60 women who resumed treatment while they were breastfeeding, and that was a big problem with our previous studies that we were able to resolve in this one. And what we show is that there is over a 60% reduction in the risk of having a relapse in the early postpartum period in the mothers who breastfed exclusively, meaning that they did not use any supplemental formula feedings for at least the first 2 months postpartum, compared to the mothers who didn't breastfeed at all. I think this is all like super encouraging news for women who want to start families with MS today. And I think my takeaway message from this is we should be super supportive of them. There is no need to fear. Your disease is not going to get worse just because you decide to have a child, and that we should really be supporting our women to breastfeed exclusively, particularly during that early postpartum period. For women in the United States, what does that mean? Not only providing lactation support and just counseling them and reassuring them, but it also may mean extending their disability leave from work to be able to get through those first 2 months postpartum.